What if your hand loses its power to move? It sounds scary, isn't it? But it's true. There is a disorder or else a condition which is called as wrist drop, where your hand is unable to lift from wrist, due to which you are not able to do your day-to-day chores like lifting objects, shifting objects, holding something, etc. So what exactly is this condition? Why does it happen? To whom it affects? And how to manage it? We are going to learn all of these in next 10 minutes. So make sure to watch this video till the end. Let's begin. Friends, if I have to simplify wrist drop, it can be called as droopy hands, which means the hand drops downwards. Now, this is a condition which limits your ability to use the hand well. So, doing simple activities like writing, picking up objects, holding something, lifting something, transferring something gets affected. But why does this happen? Well, this happens due to a damage or else compression on the nerve which is called as radial nerve. This is a nerve that starts from your brain, passes from the spinal cord and then reaches to your hand. This nerve is responsible to give power to your wrist muscles, which allow your hand to lift upwards, even fingers. It also gives some sensory feedback or sensation power to the hands. Now, this is not just one reason. Let me go a bit deeper into the causes of wrist drop. Well, if I have to classify wrist drop problem in two categories, those would be number one, which is called as upper motor neuron, which means condition that's related to brain and spinal cord, and lower motor neuron, where the conditions are related to the sides of the spinal cord and to the nerve. Now, for example, people who have got stroke, multiple sclerosis, brain injury, brain tumors, spinal cord injury, spinal tumors will have a wrist drop. At the same time, people who have got radial nerve injury, or as this nerve gets injured at arm level, or as even the forearm level, at that time also they will suffer from wrist drop, which is called as the lower motor neuron type wrist drop. As I explained, here the problem is with brain and spinal cord. In the other side, the problem is with the nerve. Now, why does this happen? So, in the brain regions, the cause is the damage to the brain structure. Whereas in the radial nerve injury scenario, the three common episodes that lead to radial nerve injury, number one is compression on the nerve. This is called a Saturday night palsy. Many a times people who drink alcohol, if they sleep whole night hanging their hand on the chair, that compression that's falling on the nerve will lead to nerve paralysis and the hand will get droopy or paralyzed. The second reason why an individual can get this type of paralysis is with the use of crutches. If someone is using crutches for a long period of time, that crutches also compresses the nerve at the armpit level and can give you the symptom. The third condition is the damage or injury to the nerve following a fracture, fall, etc. In this case also the nerve gets damaged and you will see that the hand functioning stops. Apart from this, there are two conditions that can give you wrist drop. Number one is called as lead poisoning. So if your body goes through lead poisoning, at that time you might experience wrist drop. And number two is diabetic neuropathy. If an individual is diabetic for a very long period of time, he can develop diabetic neuropathy, where the nerve starts getting weaker and an individual can develop wrist drop problem. So these are the reasons behind wrist drop. Now, who suffers from wrist drop? Well, this is a problem that can be experienced by a newborn baby to an old person as old as 90-year-old. In children, the condition cause is either due to a birth defect. Birth defect like cerebral palsy, brachial plexus injury could lead to wrist drop. Children who are toddlers who had birth defect, they will develop wrist drop following an injury and sometimes injection palsy. There are certain cases due to injection of vaccination, they develop monoplegia or paralysis of the hand, and that's where the wrist drop is seen. The other common reason is fracture again, as children quite often fall and can fracture their bones, and that fracture will injure the nerve and can give wrist drop problem. When we come to the adults, in adults the common reason again is the compression on the nerve in the armpit region, which I told you about, the Saturday night palsy, where the hand is hanged on the chair whole night and due to that compression the nerve gets damaged. Or is a crush injury, a road traffic accident, a violence episode. All of this can damage the nerve and can give wrist drop symptoms. On contrary, in elders, diabetic neuropathy, stroke, multiple sclerosis are some conditions that can give wrist drop. So, as I said, anyone can develop this wrist drop problem. It all depends at what stage and what was the cause. So, now let's talk about the management of this condition. How wrist drop can be managed? Well, wrist drop management can be classified in 3 categories. Number 1 is the medical management. Number 2 is the physical management, and number 3 is the surgical management. When we talk about the medical management, the role of medicines comes into the picture based on the diagnosis made by the doctor, which usually uses clinical presentation, history, and some diagnostic tests like CT scan, MRI, EMG, and nerve conduction velocity test. A doctor would be able to identify the root cause and will give medical management accordingly. Similarly, physical management incorporates therapeutic techniques like physiotherapy, occupational therapy, and orthosis. With the help of rehabilitation, the hand is re-educated and retrained to regain the hand movements. And number 3 is the surgical management, which is usually used in case if there is a complete rupture of the nerve, or else the medical management and the physical management doesn't work. But let me tell you one thing, all of these 3 scenarios can be applied at the same time on an individual. It is all dependent on the cause, severity, and the selection of therapy by the doctor. Now, one more thing I would like to add here is, that is, how long does it take for one to recover from the nerve injury? Now, this totally again depends on the cause. For example, if the disorder is around brain or spinal cord, it might take a very long time to recover. For example, stroke survivors might take 1 year of time to recover from the wrist drop. At the same time, if it is in compression palsy, it might recover a little bit more faster. It all depends on what was the cause and also the speed of the nerve recovery. Usually, a nerve takes 1 mm per day speed to recover. So it's totally dependent on that. Hence, it's very advisable for you that if you see that your hands are getting droopy, see your doctor immediately and get the right diagnosis at first place. So I hope in this comprehensive video, you were able to understand what is wrist drop, why does it happen, whom does it affect, and how to manage. In the upcoming video, I will be sharing with you 6 simple home-based exercises that you can do at comfort of your home to improve your wrist drop symptoms. On that note, I'll end this video here, and don't forget to subscribe to our channel, like this video if you liked it, and share it with someone who is suffering from wrist drop right now. Bye-bye.